The ARROW study is a phase 3 randomized trial in which we are going to compare Carfilzomib once weekly at a dose of 70 milligrams per square meter versus Carfilzomib twice weekly at a dose of 27 milligrams per square meter. The rationale is that here in the US, Carfilzomib single agent at a dose of 27 milligrams per square meter is approved for relapsed and refractory myeloma patients after 2 or 3 prior lines of therapy. And in addition, around the world, there are another Carfilzomib-based combinations in which Carfilzomib is always given twice weekly. With this background, and in order to improve the convenience of the administration, the Champion-1 study was a phase 1 study conducted some years ago in which a small number of patients received the Carfilzomib at a dose of 70 milligrams per square meter once weekly. And the preliminary results were very encouraging because the overall response rate was over 60%, the median progression-free survival was over 1 year, and the safety profile was very acceptable. So this was the rationale for the ARROW study, to further evaluate the efficacy and the safety of Carfilzomib once weekly at a dose of 70 milligrams per square meter in relapsed and refractory myeloma patients after 2 or 3 prior lines of therapy. From the hematological point of view, no more anemia, neutropenia, or thrombocytopenia were reported in the once weekly case 70, and the same for non-hematological toxicity like hypertension or pyrexia or gastrointestinal toxicity. And when we evaluate adverse events of a specific interest like cardiac failure or peripheral neuropathy or ischemic heart disease or even pulmonary hypertension, the frequency was very similar in both arms, and I would say that the frequency of grade 3-4 adverse event of interest was not observed in more than 5% of patients in both arms. So if we consider all these results, efficacy and safety, I would say that in comparison with twice weekly Carfilzomib 27, once weekly Carfilzomib 70 milligrams per square meter, so a favorable risk-benefit for relapsed and refractory myeloma patients, and in fact result in a more convenient regime that make possible to more patients can access to this effective combination, especially for patients with problems to come to the hospital twice weekly.